do you know there are cars in this world that cost $1 million a piece? How are people going to afford cars that they're paying $1 million a piece? Well, the answer is you don't have to buy a Ferrari. You can buy a product that fits your needs. And what I'm pleased about is that the cost for a single insured went from $350 a month for insurance to $175. Got cut in half. Now, the great thing about competition is that the insurance companies are able to offer a wide array of products. But the good news is there are new lower cost products that are available for the first time in our state. Are there more expensive products available? Of course. But there are much lower cost products also. And the mandate does not require that you buy the $800 brand or the Ferrari. It allows you to get the product that's far more price efficient and far more affordable. And so our plan is simply this: remove mandates from insurance companies. Now, my legislature didn't remove all the mandates I wanted removed. That's why I said it's not a perfect plan. I wanted to take all the mandates off. They wouldn't. That's okay. We still made some progress. We took a number of mandates off. So the premiums came down and became more affordable for a lot of our citizens. Number two, we said to citizens who are making 3 times federal poverty or more, that's $54,000 a year in our state for a family of 4, you have to buy a policy that you can afford, and no more showing up at the hospital expecting someone else to pay your way. For people earning less than 3 times federal poverty, we the state, will subsidize their purchase of a policy. They choose the policy they want. We subsidize its purchase. And that way we get everybody insured.
And that didn't cost any additional dollars to subsidize those families?
The answer is no, because we've been spending in our state about $1.3 billion a year giving money to hospitals that give out free care. So we were spending about $1.3 billion. That money came from taxes, it came from assessments on hospitals and insurance companies, it came from the federal government, it came from all of the above. And we said, okay, look, instead of paying money to the hospitals to give out free care, why don't we subsidize the purchase of insurance? And that actually, according to Professor Gruber at MIT, who built the economic model of this, that saves money. It's cheaper to help people buy insurance than it is to hand out free care. One of the reasons it saves money is that we found roughly half of those without insurance could afford to buy it. They just weren't buying it. And so we insist that they buy it. Now, there are other ways to go, and other states will try other paths. But the key point is this: we don't have to expand Medicaid to cover everybody in the country. Medicaid is a lousy insurance product. It's a product designed for the poor and carries out a function there which is commendable, but it doesn't have a participant pay for the premium, share in the premium. It does not. It has a cliff eligibility standard. It's just not a great insurance product. So we put in place free market products and help people buy them.